Welcome. I'm joined by Dr. Kirk Knowlton from the Intermountain Medical Center Heart Institute. Thank you for being with us today.
Thank you,
We're
Jess.
going to be talking about a study that you are leading that was presented at the AHA Scientific Session in Anaheim that really is looking at LDL measurement. Tell us a little bit about it.
Yeah, sure. So at Intermountain, we're very interested, as a matter of fact, in trying to improve the prevention of heart disease or stroke in people who have already had a heart attack or a stroke. And so we've done a very large retrospective analysis of the entire Intermountain system and the data that's available on our medical records since 1999 through 2013. We identified 62,000 patients that had had an event, and then we looked at their treatment and a variety of different measurements and tried to figure out what are the characteristics that best determine those that will survive and without having an event.
Okay, well, let's look at some of your results. Tell us what we have here.
So I think this one tells a lot of the story, as a matter of fact, in that if we looked at individuals in whom the LDL cholesterol was measured anytime after their event versus those in which it was not measured, we found that there was a huge difference. So, for example, this is a Kaplan-Meier curve over a period of about 15 years, up to 15 years. And if they ever had an LDL cholesterol measured, they had much better event-free survival than those that never had an LDL cholesterol measured, suggesting that maybe it's really important to follow that parameter and make sure that we're treating to that parameter. And we can look at some of the other details.
Let's take a look at your next slide and see what we have here.
Right, so since there are different kinds of atherosclerotic cardiovascular disease events, we wondered if this survival pattern was similar amongst all of them. So, for example, we have coronary artery disease, cerebrovascular disease or stroke, and peripheral artery disease. And what we found is that the pattern stayed the same, and here you can see the dramatic effect or the association. If an LDL cholesterol was not measured at 3 years, there was a 35% MACE rate, whereas if an LDL cholesterol was measured, it was less than half that. And basically that carried through in all three different categories of disease.
What does that tell you?
Well, that tells us that for anybody that has atherosclerosis that's had an event, we should be really careful about probably following their cholesterol levels and making sure that we're optimizing them. At least that's what this retrospective analysis suggests.
Great,
Yeah.
and we have one more slide here.
Right, so in this slide, this tells us two things. One, it tells us what the specific events are associated with this major adverse cardiac events that we studied, which included the overall events at 3 years, death, myocardial infarction, stroke, and whether they had any kind of revascularization. And this group on our left, as we look at the screen, shows those that did not have an LDL cholesterol measured. And the blue lines are those that did not receive a statin medication, and the green line are those that were treated with a statin. So we can see that in all groups, there was improvement, particularly death, and overall there was a significant improvement in a decrease in death if they were treated with a statin medication. But compared to those that had their LDL cholesterol measured during the follow-up period, it doesn't reach nearly the same level, comparing, say, 35.7% versus, say, 16.2% here in the overall, and the death was even more dramatic, really remarkable.
What does that tell you? What does that tell you looking at that comparison?
So I think that even though this group, without having an LDL cholesterol measured, were treated with statins, they did not see the same effect that we saw with those that had their LDL cholesterol measured and were treated with statin. So that kind of addresses a question that people are wondering about nowadays as to, should I just treat and forget, or should I treat and treat to a target? And I think the guidelines more recently are suggesting treating to a target, trying to get the LDL down to a level of less than 70, for example. And that's what this would support, is that in fact that could make a big difference.
Well, thank you for taking time today to share your results with us, and congratulations on a wonderful study.
Thank you, Jess.
We invite you to stop by the AHA Scientific booth for Intermountain Medical Center Heart Institute to learn more information, as well as going to our website where we'll have these abstracts along with posters and other abstracts available there. Thank you so much for joining us, and have a great day.